Good afternoon. I'm John Falchicchio, Deputy Mayor for Planning and Economic Development, and welcome to this week's Recovery Weekly Check-In with DMPED. Today I'm joined by a number of panelists, which we're excited to hear from. First up is Director Sean Townsend, the Director of the Mayor's Office of Nightlife and Culture, followed by Mila Kaufman, who's the Executive Director of the DC Health Exchange Authority, and then Marianne Lombardi, the Associate Director, DC Office of Creative Affairs. And she'll be joined by visual artist and photographer Violetta Marcolou, who's going to talk to us a little bit more about the creatives in the economy a little bit later. But just a quick reminder, if you're listening on the phone, if you do have a question throughout the program, you could hit 0. That'll give us a chance to see you in the queue and bring you into the show a little bit later. So first up, I want to bring Sean Townsend into the conversation. Sean and I were at the Rammies this Sunday, and then on Monday, Mayor Bowser officially announced the Streatery Winter Ready grant program, an opportunity for streeteries and restaurants that have streeteries to apply for a $6,000 one-time grant, which will allow them to buy the hard costs that they have, to cover the hard costs as well as the soft costs that they have to get ready as we transition from summer into fall and then eventually into winter. So I want to welcome Sean Townsend into the program just to give us a little bit of an update on the Streatery Winter Ready Grant Program.
Thank you, Deputy Mayor, and I also would like to thank Mayor Bowser for her leadership throughout this process, and the entire DMPED team and our sister agencies for helping us get this off the ground. I just wanted to give a quick update on the Streatery Winter Grant Program, and it's not only the grant itself. It's a relief package that we tried to put together amongst a couple of agencies. So a couple of things I do want to point out about the grant itself. Eligible establishments must have at least 50% district residents, DC resident as an owner. 50% of the gross receipts must originate in DC, and 50% of the employees must be DC residents as well. So the businesses must be one of those requirements must apply to the business that submits an application. In addition to that, a clean hands certificate within the past 90 days, an active business license, and also an approved district, a DDOT approval to have outdoor space. That's so much information, I'm losing it, Deputy Mayor. We have begun to accept applications beginning on Monday, September 21st, so it's our second day, and we've seen a large amount of applications over the past 2 days. So I would encourage all businesses, if they haven't yet, please do submit your applications to be considered for the grant. In addition to the grant funding, we also announced yesterday that the Office of Risk Management has pushed back their new outdoor dining insurance requirements until January 1, 2022. It was initially slated to go into effect January 1, 2021, but in order to provide additional relief to our restaurants and food retailers, we wanted to make sure that that did not happen this January coming, so we have an additional year for that. In addition, I'd like to thank DCRA and FEMS who really worked on their end to streamline the process to apply for a tent or propane permit. Both fees have been waived for the tents and propane permits. It's a one-stop shop application, and you would go through our DDOT TOPS system to apply for a propane and or a tent permit. Both of those permits, we are shooting for a 36-hour turnaround time for both tent and propane permits at this time. If you have any questions about the application process or any of the relief initiatives or opportunities that I just mentioned, feel free to email us at nightlife@dc.gov. Once again, that's nightlife@dc.gov. Starting on October 1st, we'll begin dispersing funds to the award recipients. Between now and then, you will receive a conditional award letter requesting a budget for the items that you intend to spend the grant funds on. So I think I'll pass it back to Deputy Mayor. If there are any questions, once again, nightlife@dc.gov, and that wraps it up.
Thanks, Sean. And for those watching at home or listening on the conference line, if you have a question for Sean, you could press it 0 now, and that'll put you into the queue when we go to the callers at the end of the program. And Sean, just for our awareness too, so there are also some partners that we're working with to execute upon the grant. Let's give them a shout out as well.
Yes, so the Restaurant Association of Metropolitan Washington and the Latino Economic Development Corporation have both been outstanding partners throughout this process, and they will continue to help us throughout.
Thanks, Sean. And the reason I wanted to mention those two organizations is because they're going to help us facilitate the grant agreements once we have the applications in, and sometime after October 1st, you'll be hearing from the Mayor's Office of Nightlife and Culture, but you may also hear from one of those two organizations, which is the Restaurant Association or the Latino Economic Development Corporation. So more to come on the Streatery Winter Ready Grant Program. And I want to bring in next Mila Kaufman, who's the director of the DC Health Exchange Authority. And what we wanted to talk about, Mila, something you're well versed in, is a lot of people have seen changing employment status. Businesses have seen changes to their employee counts throughout the year, and so we wanted to have a discussion about that all-important issue, which is health insurance and health coverage for our residents, which we know are sometimes there are self-obtained or obtained through their employers, whether it's a for-profit or a nonprofit. So with that, I want to bring in Mila Kaufman just to talk about the work of DC HealthLink.
Thank you so much, Deputy Mayor Felcicchio, for all your work and your work with us. It is a privilege to be in public service, especially now and in a city where our mayor is strong and fearless. And what we all do is the difference between life and death and financial security or bankruptcy. So it's a privilege to be with all of you today. The DC Health Benefit Exchange Authority is a private-public partnership that was established by DC policymakers to be responsible for the Affordable Care Act's online health insurance marketplace here in DC called DC HealthLink. Next slide, please. Although we were the last state to start building our IT system, we were one of 4 to open on time for business on October 1, 2013. And since we've been open, we have helped the district cut its uninsured rate in half. So now nearly 97% of our residents have health coverage. We, in fact, rank number 2 in the nation for the lowest uninsured rate. And we rank number 1 for our consumer decision support tools for businesses and residents. We've also been recognized by a number of entities, including receiving 3 Amazon Web Services IT awards, and the Massachusetts Health Connector chose us to replace their old technology for their small businesses and to run it for them. We've also been recognized through many PR News awards for our enrollment and outreach. We cover about 100,000 people, which includes about 80,000 covered through district small businesses as well as nonprofits. We also cover Congress, including their district offices, members, and designated staff. And we provide coverage to about 17,000 residents with individual market coverage. We have 156 different health plans from Aetna, United, Care First, and Kaiser. And for individual residents, we have 25 different health plans from Kaiser as well as Care First. Next slide, please. For COVID-19, I want to walk you through 3 major things that we've done to help residents and employers. First, I'll talk about what we've done to help residents get insured. Then I'll talk about what we've done to help small businesses and nonprofits get insured and stay insured. And then I'll talk about some of the things that we've done to remove barriers to care to help residents and businesses. Next slide, please. First, what we've done to help residents to get insured. We created a special enrollment period to allow any resident to get insured now and not have to wait until the next open enrollment period. Now, usually, a resident has to have a special life event like marriage or a child or divorce or moving to the city to qualify outside of open enrollment. We did not want to make anyone wait. So we just opened up our system and said anyone who is uninsured who needs coverage and wants it can come in and get insured. Now that special enrollment was due to expire September 15th. Our board unanimously decided to extend that through January 31st, and automatically that will be extended should Mayor Bowser decide to continue or declare a new public health emergency. And what's really important is if a resident signs up today, let's say September 22nd, the resident decides when the coverage should start. The coverage could start September 1 or October 1, so it's immediate, and a person does not have to wait to be covered. We also have a special enrollment for employees and dependents covered through nonprofits and small businesses through DC HealthLink. If those folks declined coverage in the past, they can come in and get enrolled now. They don't have to wait until their employer's next open enrollment. And just to share some data points with you, we've had about 5,000 residents who've signed up for individual coverage through this special COVID-19 enrollment. And we've also had about 800 people who signed up for employer-based coverage, who've turned down their coverage in the past. Now, the reason why that's important is because some of those employees may work for a DC business but live in a state like Virginia that relies on the federal exchange. And the federal government did not open up their system for COVID-19. So if people live in states relying on the federal exchange, they cannot get health insurance. And then just another point of comparison looking at our data. We know that opening up our IT system and open enrollment is important to residents. Comparing this year's enrollment to last year's enrollment, looking on a weekly basis, the week of April 5th, we had 71% higher signups this year than last year, the same time period. And through today, we're trending at about 20% higher signups than where we were last year. Next slide, please. Now, what we've done to help small businesses and nonprofits get insured and stay insured. We waived requirements for employers to have a minimum premium contribution. Usually we require an employer to contribute 50% to the employee's premium. That no longer applies. If the employer can't contribute anything, that employer can still sign up and offer coverage to the employees and dependents. We also created a new premium deferment period. And the way that works is employers who are enrolled now can defer their premiums through the public health emergency, and they have 60 days after the public health emergency ends to start paying their premiums. In addition to that, and really a big thank you to our insurance commissioner, Karima Woods, for her emergency orders that protect insurance consumers here in the district. She issued emergency orders in the spring that say that people have a full year to pay back their prior owed premiums. And that starts after the public health emergency ends. We implemented that very quickly for our covered employers. We also never charge late fees or interest for delayed or late premiums. We're also not terminating anyone's coverage. That's another consumer protection in Commissioner Wood's emergency order. No terminations of coverage during the public health emergency. And that's been a lifeline. We have about 800 employers who are late on their payments. Usually before COVID, we saw about 75 employers each month be late. Right now we have 800 employers who are just hanging on, and the protections adopted by the insurance commissioner are really critical for us and the employers. And we worked with all of our health plans for premium relief. Both CareFirst as well as United Healthcare offered $4 million in premium relief to DC HealthLink employers. And we implemented that this summer, so our covered employers saw those premium reductions right away. Next slide, please. I'm going to conclude by highlighting what we've done to remove barriers to care for residents and businesses. We worked with all of our health plans, and they agreed to provide free telemedicine, so no-cost telemedicine for a period of time for all care, mental health care, primary care, specialists. So telemedicine, telephone calls, video visits, emails were all free for a period of time. In addition to that, our health plans agreed to provide free diagnosis and free testing for COVID-19. And thanks to Commissioner Wood's emergency order, the health plans are also required to provide no-cost treatment for COVID-19. So just to summarize the last slide, all residents have an opportunity to sign up for affordable quality health insurance, and the coverage starts immediately. District small businesses and nonprofits can get insured and stay insured, and residents and employers have free COVID-19 diagnosis, testing, and treatment for all DC HealthLink plans. And I would just like to thank some of the other agencies who worked closely with us. The Department of Employment Services included health insurance information about our availability for all people who were applying for unemployment insurance. And DC Health's contact tracers are including our information in their work. So thank you very much, and I'm happy to take questions.
Thanks so much, Mila. And I noticed in the presentation that you mentioned an extension of the public health emergency. Today, our partners on the council passed legislation to give the mayor the authority to extend the public health emergency until December 31st, 2020. So we'll look for the mayor to make a decision on that, but it looks like that support will be coming as well. And then important always to kind of share that website where people can get information.
And that's dchealthlink.com.
Thanks so much, Mila. And we'll come back later because I know folks will have questions. Healthcare coverage is something that has been on many people's minds throughout the pandemic. So thanks for being here today. Next, I want to bring in Marianne Lombardi. Just a few weeks ago, we had Director Gates and Natalie Cofield of 202 Creates here to talk about some of the work that they're doing to help district residents and collaborate with artists and creatives. And today, Marianne, you're going to talk to us a little bit more about an important initiative that the Office of Cable Television, Film, Music, and Entertainment, as many times as I've said it, it always trips me up. But just to talk to us about a new program called Care for Creatives, and you've got a guest, Violetta, who's joined us as well. So Marianne, I'll turn it over to you.
Great. Thank you so much, Deputy Mayor. I'm really thrilled to be here. Yes, my name is Marianne Lombardi. I'm the Associate Director of the Creative Affairs Office. And I'd like to take a second to thank our Director, Angie Gates, of the Office of Cable TV, Film, Music, and Entertainment for her passion, creativity, and leadership. And of course, I want to thank the Mayor, because without her vision, this office, the Creative Affairs Office, would not be in existence. She launched this office back in September of 2019, and we're thrilled to be able to continue her vision for supporting the creative economy. The Creative Affairs Office, we really do three very important things. We're focused on policy and policy awareness, and what that means is that we're looking at creative policy. What kind of policies exist to support our creative entrepreneurs? What policies may need to exist? How do we help create them? How do we look at what is already there, and how do we make it available for the people that we serve? We're also really working on infrastructure, and we see infrastructure as a conversation between personal infrastructure, so not just physical infrastructure like space, but also what is the infrastructure that you as a creative or an entrepreneur or a small business need to really do your work and be able to get it done, and that's where this program, Care for Creatives, comes in. We also are working on economic mobility, and this is also a conversation between saving money and earning money. So we're creating programs, opportunities, activities for folks to do either of those things, to complete their businesses, to do their work, and be able to stay and live in this wonderful district that we have. Next slide. So let's talk about Care for Creatives. We all need help at some point in time, and these past 6 months have been incredibly hard for many of us. But we have heard over the years that mental health support has been something that our creative community, that our entrepreneurs have asked for and needed all along. And so we're really excited that the Creative Affairs Office and OCT FME have partnered with GW, specifically the Graduate Program for Education and Human Development, and GW's Community Counseling Services Center to provide pay-what-you-can mental health service for any creative, any entrepreneur, any small business owner who may need it. And it's a pretty simple process. Really, all you have to do is email ccscfoggybottom@gw.edu, gwu@edu, and you'll get paired with a clinician. It's been a wonderful program pairing folks who need help with also students who are learning and becoming clinicians. So it's really been a spectacular program so far. So we're thrilled to that. And so we have the email up on the slide, so I hope you can see that. And also, if you have a question, you can always email me at marianne.lombardi@dc.gov. Next slide. So it is 202 Creates Month, and if you don't know that, you do now. So what does that mean? That means it is Creative Economy Month for everybody to come on down and get creative. If you go to 202creates.com, you'll find out about all the things that are still left to do in September and find out about activities that have already happened. So every September, every year is Creative Economy Month, where we celebrate those creatives. Now, we're coming down the pike to go to the Mayor's Arts Awards. This is at the end of the month, September 30th. Super excited about it. It is the 35th annual Mayor's Arts Awards. It is going to be televised. We're something that you should be able to see on DCN. It'll be live streamed on all of OCTFME's platforms. So it's something that everybody should go check out. Also, we have Park Up DC. We're going to have a social distanced watch party happening at Park Up DC. But you can find out any information about the Mayor's Arts Awards at dcmayorsartsawards.com. And I'm kind of excited about our host. You guys want to know who's our host this year?
I do.
Yeah. Sean, do you want to know who our host is? Absolutely. So our host this year is comedian Tommy Davidson. So I know, isn't that awesome? Yeah, we're pretty excited about that. So if you didn't already want to come, you know you want to come now because our host is Tommy Davidson, right? And you're going to get to see awards of all sorts of creatives all over the city, performances, talent. It's going to be quite a show.
Marianne, so is Tommy Davidson going to be on Lot 5 of RFK?
Well, he's a part of the virtual broadcast.
I see. Okay.
Yes.
I'll be on Lot 5. I don't know if that'll draw anyone.
I think so.
Okay.
Can you crack some jokes?
That was the best I had, actually.
Okay. All right.
So why don't we just make sure that we give that information. If we could pull it up on the screen again, just to talk about the Care for Creatives a little bit more and just kind of how did that come to be? Because I know this is a trying time We talked a little bit about the health link and how people can connect to the health of their body, but this is also to help kind of the mind and the soul. So how did this come to be?
Yeah, well, I have to give a lot of credit to the creatives who have been saying to us over the years how important it is to have mental health support. And it really, it's really because of them telling us that they need that support, that we really have gone out and found a way to provide that for them. You know, and I actually was having a conversation with a colleague of mine who works at GW and runs the CCSC, this Counseling Services Center, and we were talking about how we really need to find support for our creatives, and she was talking about how much they need folks for their clinic to see, and out of that became this really wonderful partnership.
Great. And we've got Violetta here. You want to bring her into the conversation? We've got heard from all the government folks. Now let's hear from a creative directly.
Absolutely. This is Violetta Markalou, who is a photographer and a visual artist. And Violetta, do you mind telling folks about the work that you do?
Sure. First, I want to say thank you, Marianne, for having me, and thank you all. Just extremely pleased and surprised to get your email about the Care for Creatives initiative, and just really happy we connected. I'm a photographer and visual artist. I live in D.C. I live in Adams Morgan, and I've been a photographer for 20 years. I'm passionate about helping people discover themselves through my portraiture, helping them to create the image they want to see of themselves, to project their authentic self and their business in the exact right light that they want. So that's what I do.
Fantastic. And some of the audience will be able to see, if they're watching on Channel 16 or Facebook, some of the work that you've done. You want to tell us about Lady Clipper on U Street?
Yeah, absolutely. Right now what you're looking at is my current photo series called Inbox Full. And Inbox Full is a metaphor for the mind, because at the start of this pandemic, I was, going through a lot of anxiety and a lot of change, obviously inundated with paperwork and grants and filing for unemployment, so a lot of mental and emotional stress. And I really wanted to bring awareness to what our fellow creatives, small business and entrepreneurs are going through. I had a front row seat to it, and I just started reaching out to the community around me. And yes, Leslie, I was following her on Instagram, and I saw that she was speaking about what a difficult time she was having. And I asked her, I said, would you be part of my series and share your experience with me? So yeah, she said, absolutely, I would love to. And I took her portrait, and I also did an interview with her and transcribed all her words, and was able to tell her story and how she's coping through this really difficult time.
Absolutely. And I think we have one more slide to show.
Yeah, this is Louis Hankins. He's the owner of El Techo Rito Loco. That is a rooftop bar and restaurant, Mexican, right next to the Howard Theater. And he started as a food truck, and he really went through a very, very trying time for 3 years getting a permit for his rooftop. And, this business means everything to him, so potentially losing it was causing him a lot of health problems, chest pains and just a lot of mental and emotional stress. And I knew that he's a friend of mine, and I said, would you let me take your portrait? And there he was, and it was the golden hour. And, this picture says a lot, because you could see all the stress on his face. And anyone who wants to see and read about the stories of our creatives and small business owners and entrepreneurs, I profiled 13 of them for this first series. You could see that on my website under the series category. And I'm working on the second phase of the series right now.
Great. And could you share your website too?
Yeah,
please?
absolutely. It's my name, so it's violettamarkellu.com.
Great. And we'll make sure we share that on our social media as well.
Yes.
We do have a couple questions, and they've come in from social media as well as some callers. I think we might be having a little bit of trouble with the call line, but you can still press 0, and we'll be able to get the question, and then I'll try to dish them out as we get them. So as you can imagine, there's a couple questions for Sean. The first one, Sean, is from Jennifer, who asked, so the grant award is $6,000. How much of it can be used for hard costs versus soft costs?
So the soft costs in terms of marketing or advertising, we will allow up to a third of the $6,000 to be used for soft costs. All of the hard costs, including your equipment, lighting, propane, heaters, those types of things will be your hard cost, and you have to use 70% of the funding for that. But a third of it can be used for advertising and marketing.
Okay, thank you for that. Another question, if we could stick with you, Sean, is Ahmed in Ward 2 had a question about permits. Are there temporary permits to apply for like a newly acquired restaurant? So I guess the Streatery program, how do they apply?
Yeah, if he's a new restaurant, he can. There's a section on coronavirus.dc.gov under Phase 2, reimagining outdoor spaces. There's a ton of information on that site that it actually takes you to DDOT's website, TOPS, where you can start applying for outdoor space. And it also provides a guide to help get you through the process for an outdoor permit.
Okay. And next, Mila, there's a question from Kelly, who's a business owner in Ward 2 and 6, and she wanted to know where does she find out about more resources for business owners to provide employees insurance? And specifically, she was asking about the timeline for setting up, setting up that service, and then also can they choose individual plans, or does the employer have to pick a group plan?
Thank you for that question. So go to dchealthlink.com. All the information is there. If you click on the employer button, you will get detailed information. If you want to work with a broker, and by the way, DC HealthLink brokers are free to you, no cost, and they're all on our website. You can work directly with a broker to set up a group health plan. And the way it works is that you, the employer, have lots of choices. Just like large employers had before the Affordable Care Act, now in DC, small businesses have the same options as large companies. You can offer any level of coverage to your employees. You decide how much to contribute. Your employees can pick any health plan in that level of coverage from any insurance company. So some may pick Care First, Blue Cross Blue Shield, others can pick Kaiser, others can pick United, and yet others can pick Aetna. You decide how much to contribute. The rest of the premium comes out of the employee's paycheck. Every employee gets what works for them, and we make it very easy. You get one bill from us. You have other options as an employer. If you decide you want to pick one insurance company and let your employees decide what level of coverage to pick, you can do that as well. Again, go to dchealthlink.com and get all the information you need. And you can also email me directly if you'd like. And my email is milaKaufman, Kofman, @dc.gov. And I can get you all the information you need. And we look forward to having you as a DC HealthLink customer.
So, Mila, thanks for that update. I know you mentioned my healthcare provider, which is a good reminder for folks to get their flu shot. We're asking everybody to get their flu shot because flu season is upon us. And if you are looking for a place to get a flu shot, you can actually do it at our F Street coronavirus testing site. So you can get both a coronavirus test as well as a flu shot with a partnership that we're doing with Walgreens. And so if you come to the F Street site, it's open on weekdays between 8 a.m. and noon, and that will allow you to get both the coronavirus test as well as the flu shot. Now, we do ask for the flu shot that you bring your insurance card and your photo ID for that process. So next up, we want to bring in a caller. I think we'll see if this can work. Greg in Ward 2. Greg, are you there?
Yes, I am. Can you hear me?
Absolutely. Greg, I think you had a question for Sean. Greg?
Yeah, I do.
Okay, fantastic.
So we have a restaurant in Ward 2. It's called Tonic, and we shortly after the pandemic started, we started having trouble paying our sales tax because our revenues went down so far. But we got in touch with OTR. We have a payment plan in place with them to pay those past due sales taxes. But because we do have past due sales taxes, we can't get a clean hand certificate that's required by the Streatery grant application. So I'm wondering if there's a way that we could work around that somehow and still be able to apply for the grant, because we are following, we're doing what we're supposed to do. We're following the rules, and we're making the payments on our payment plan. Is there a way that we can still apply for the grant?
Thanks, Greg. That's a good question, and we've actually had conversations with OTR prior to the release of the grant. From my understanding, as long as you have a payment plan in place, they will issue you a clean hand certificate for this grant. So I can follow up with you. If you can email me at nightlife@dc.gov, I'll follow up with you directly so we can discuss that further.
Thanks, Greg. Thanks, Greg, for calling in and with that question. And Sean, thanks for following up with Greg on that. I know that one thing that the CFO, Jeff DeWitt, likes to say is that, we want to make sure that businesses have that opportunity to stay open. And this would be an example of if we can work on making sure that Greg and other businesses have a clean hands, that they can get that resource that they need through the grant program. So, Sean, thanks for working with us on that.
Absolutely.
So we have another question via Facebook. This one is for Kristen Barden, and she asks, can we repeat the 50% requirements?
So 50% ownership must be DC residents. 50% of the gross receipts have to originate in DC, and 50% of the employees must be DC residents. So one of those requirements must apply to the business that's submitting an application.
Okay, and that's actually a similar question that we had during the microgrant program.
That's correct.
So we just kind of emulated what we had on the microgrant program.
We copied DMPED, yep.
Great. Well, thank you. Well, we're partners, so it's okay to copy every now and then. But Marianne, so tell us a little bit more about kind of the 202 Creates. We know we have Art All Night coming up. How are we partnering to make sure that we keep the vibrancy of 202 Creates Month and Art All Night, and make sure that our creatives and our artists get highlighted this month?
Yeah, well, if you go to 202creates.com, you'll find that we have a full calendar of events that are happening. And even though some of our businesses have stopped, our creative activity has not, right? Like, our creatives are still working, they're still creating, there's still activity. And so if you go to the website, you'll be able to find that there are all sorts of things that you can still take advantage of.
Absolutely. And so, Violetta, really interested in the project. So what made you start the project? What kind of inspired you to get rolling on it?
Well, I just find that in times of struggle, to overcome your fears, I have to go out and create. And I really, really was wondering and just was curious how all my fellow artists and business people were doing, because they're in my community, they're friends of mine, and they're just part of my network. And I just really wanted to bring awareness on how just everything they were going through. You're just inundated with, paperwork, grants, unemployment, just worrying about the future. There's so many question marks, and I just wanted to bring awareness to everything they were going through, and just also talk about how important they are to the fabric of this community.
And what surprised you when you were, going through the project? What was surprising to you?
Well, I have to say I wasn't really surprised by anything. I was expecting the full gamut of emotions that people told me, from hope to fear to gratitude to I'm pivoting this way because, I expected all of that. And, our creatives and our entrepreneurs, I mean, they use all their creative talent and skills to make a situation better. That's what we're good at. So I expected all of them to thrive, but I also expected, to hear a lot of loss and sadness and all the other things that go along with such a massive change in our lives. So.
Yeah, and so what was the reaction when the individuals see their portrait?
Yeah, they were, I think, all across the board, everyone expressed gratitude overwhelmingly to me, just saying thank you for telling our story. I really want people to know what we're going through. Just overwhelming, it was gratitude, They wanted to be seen and heard, and I also felt very overwhelmingly that their stories need to be seen and heard. So I'm very happy to do this work and continue this work.
And I'll just add, Deputy Mayor, that this particular photo of Louis, who's a restaurant bar owner, it resonates with me, and I can see other operators in this image, and I can also hear other operators in his image as well, just talking about the stress and the frustration that they've been dealing with over the past couple of months. So I can definitely feel this picture. It's a really good picture.
I appreciate it. Thank you.
And I think a lot of times we talk about sort of the programs or the resources that the government has to offer to people. So bringing these portraits to us today kind of really gives us kind of the reason why we're doing everything that we're doing, and also knowing that there's real people who need the help. So I really want to thank you for bringing this to us. I know we had some other questions too that we wanted to get to. Mila, just I guess the big thing, and we've talked a lot, I know people have mentioned pivots, and the pivots really that we're experiencing in 2020. So as a business, if they are closing down, what happens in terms of their employees? What's the best advice for them to plan? Because I think we even know that we've heard from some restaurateurs that even with the grant program, they may have to close in the coming weeks. So how do they plan for the health insurance for themselves and also their employees?
So if the business is closing, then for the employees who are DC residents, they can go to dchealthlink.com and either sign up for private individual health insurance, or depending on income, they may actually qualify for public insurance called Medicaid. And that's free. And that's all done also through dchealthlink.com. Now, if we've had situations where the business is not closing completely, but is downsizing. So if you're downsizing, then and you can afford to hold on to your health insurance, my advice is you hold on to it, because the chances are if you don't offer coverage, you might be uninsured yourself as the owner. Plus, offering coverage gets you lots of tax benefits. It's just more cost effective than not offering coverage. Also, it's never good to be without insurance. For many, it's the difference between staying financially secure or being in bankruptcy and losing everything if you get sick. So health insurance is both access to medical care as well as the financial security that people need.
No, absolutely. Thank you, Mila, for that. And I think one more time, your website?
dchealthlink.com.
Great. And what I want to do is just give folks a final opportunity to wrap up today, just to kind of give that final thought, what they want to share, kind of what's top of mind that they want to leave with our viewers. So we're going to go first over to Mary Ann and ask her to start us on the closeout.
Yeah, I would just, thank you, Deputy Mayor. I would just say, if you feel like you need help, ask for help, right? That's what I would say, right? We all need help sometimes. So if you need help, ask for help. There is help available. And you can email ccscfoggybottom@gwu.edu.
And Violetta?
I just want to say thank you again, and I really appreciate the Care for Creatives initiative. I told a few friends of mine about it, and they said, "Wow, thank you for letting us know." And I plan on, spreading that message. And yeah, if anyone watching this knows a business owner that really wants to share their story with me, please feel free to contact me. ViolettaMarkelu.com. There's a contact form, and I would be happy to know and speak with you and work with you and know your story. Thank you.
Violetta, thanks for giving the website, because I was going to draw it out of you if you hadn't given it. Sean, best advice for folks as they prepare to apply for the Streatery grants or other programs that we have?
Just say to look at the requirements of eligibility while you're applying, and if you have any questions, feel free to reach out to us at nightlife@dc.gov. This is one of the ways that we, in partnership with our sister agencies, we were able to provide this grant opportunity. We know that for some who are not open and had to close down, this opportunity doesn't fit their situation. However, for those businesses that are still, trying to make ends meet and trying to survive as the weather starts to change, we wanted to be able to help defray some of the costs that some of these businesses will experience. So we encourage everyone to apply. There's still some time to submit an application, and we look forward to working with you all. Thank you.
Thanks, Sean. And Mila?
Thank you. So we're here to help you. Go to dchealthlink.com and please let us help you and stay insured.
Thanks, Mila. Just also a reminder for folks that we will, or DMPED has out on its website, DMPED.dc.gov, a grant opportunity for Great Streets. So if you're in one of the Great Streets corridors, our grant opportunity is open now, and it closes on Monday, the 28th. So for those businesses who are restaurants, retailers in the Great Streets corridors, look to dmped.dc.gov for an opportunity. We also have information on the site about what the Great Streets corridors are around the district. So a great time to check out dmped.dc.gov on that grant opportunity as well. So we want to thank everybody for joining us. We have gone over a lot of information on today's Recovery Weekly Check-In. And so what we'll do is we'll make sure that we continue to post information on the coronavirus.dc.gov website and look for the tab that says Recovery. Just also a reminder that testing is still available. If you call your doctor and your doctor for some reason is not able to provide you a test, we have sites throughout the city that offer testing both in the morning and in the evenings and even on Saturdays. So look at coronavirus.dc.gov for all of that information as well. So thank you for tuning in, and be safe and have a good day.